Now, did you know that pregnancy can affect your teeth and the way you care for them can differ depending on the stage of pregnancy that you're in? Well, this morning, Dr. Adilah Mahabir, a dentist attached to the Tobago Regional Health Authority, will tell us about these oral challenges and, of course, the best practice for dental health during pregnancy. Dr. Mahabir, good morning. Thank you so much for joining us on Now.
Thank you very much for having me. Good morning to you all as well.
I am so looking forward to this conversation because I never knew that there was a relation between pregnancy and oral health. And so let's talk about pregnancy in terms of the trimester. So let's look at the first trimester as we begin the conversation.
Okay, so there are lots of changes that happen during pregnancy in the body, and it also affects the mouth. So there are a lot of hormonal changes that happen. And what happens is that you get an elevated immune response with the gums. So it reacts a lot more harshly to bacteria, which leads to a lot of gum inflammation in the mouth, right? During the first trimester, what I would like to talk about is the dental timing considerations during pregnancy. So what is safe during each trimester and what will not be recommended.
Right.
And during the first trimester, that is when you have a lot of your fetus organs are forming. You have a lot of cell division happening. It's a very critical part of the development of the fetus in the first trimester. So generally in dentistry, within the first trimester, what we recommend is that you keep up with your regular dental cleanings, your regular checkups. However, most dental procedures, the safest time to perform them is in the second trimester. Another misconception I would like to clear up is that lidocaine, which is the local anesthetic that is used throughout dentistry, is safe throughout the entire pregnancy duration.
Interesting. And so what about this second trimester?
Sorry, I'm not hearing you properly.
Dr. Mahabir, hearing me now? Hello, still nothing. All right, can you hear anything from me now?
Yeah, hearing you now, yes.
You're back, nice. So let's also transition into the second trimester now. I mean, what can expecting mommies expect during that time? Is it that they need to pay particular attention again to their teeth during that period? Still not hearing
you.
All right, so we're going to see if we can sort you out, Dr. Mahabir, because I'm not sure exactly what's happening. Still not hearing me?
I'm now hearing you, yes. So
okay,
it's coming
good.
In and out.
Okay, so let me see. Can you hear me still? Yes?
Yes, I can hear you.
Okay, good.
Now, yes.
Nice. So I wanted us to transition to this second trimester. Tell us about the oral challenges, changes, and how we can ensure good dental health during that period.
Okay, so during the second trimester, it's very safe to do most dental treatments, your root canals, extractions, cleanings, deep cleanings, fluoride treatments, fillings as well, your regular checkups. Everything is safe during the second trimester. Another thing I would like to take into account is that there's another misconception that when you are pregnant, your teeth become brittle or you get shaky teeth. Now, to an extent, this is true. Because in pregnancy, what happens is that with the changes in the hormones, you are more prone to gum disease or periodontal disease. And this can manifest as swollen gums, tender gums as well. And you can also get shaky teeth. And in addition to this, you are also more prone to cavities. This is because you have, your cravings and eating all sorts of hours and sorts of low nutrition foods and more snacking. And this can increase the risk of dental cavities in the mouth. In addition to that, you can also have dental erosion, which means the wearing away of the teeth. And this is because of morning sickness and vomiting as well. And all of that acid and as well as acid reflux can wreak havoc on your teeth. Now, if these things go untreated, if periodontal disease or gum disease goes untreated, you can have shaky teeth. If cavities go untreated, especially if they were existing before the pregnancy, then you can have teeth breaking and you can end up with pain and infection. So it's very, very important to visit your dentist. And I also have some recommendations in terms of preventing it from reaching to that point of pain and infection and shaky teeth as well.
Yeah. Now, before we go on to the recommendations, Dr. Mahabir, I just wanted us to kind of differentiate between what happens in the first trimester and second trimester? Because you're saying that in the second trimester, it's better to do certain procedures. Why is it advised in the second trimester rather than the first?
So in the second trimester, the formation of the organs are mostly completed, therefore the risk to the fetus is low. In the first trimester, you still have a lot of active organ formation and cell formation and dividing going on. So the fetus is more susceptible to stress and trauma responses in the first trimester. And 50 to 75% of most spontaneous abortions occur in the first trimester, as well as malformations if the fetus is put under stress in the first trimester. So this is why we try to err on the side of precaution and avoid doing anything too stressful within the first trimester when it comes to dentistry.
Yeah. And during that second trimester as well, is this the point, if it is you want to do dental braces, for example, do you also suggest that you can do this as well?
Yes, braces is safe during pregnancy. There's no contraindications, no absolute reason why you cannot do braces. However, it goes back to being able to control the pre-existing conditions, meaning your cavities and gum disease. If you have gum disease and cavities, you need to stabilize that and sort that out first before you put braces on, because then, the braces can sort of make those situations worse.
Yeah. And I know you wanted to touch on the recommendation as well, Dr. Mahabir, but before we get to that as well, tell us what happens in the third trimester, while, of course, they're preparing for delivery and that sort of thing.
Yes. So in the third trimester, again, most dental procedures are safe within the first half of the third trimester. Same thing, just like the second trimester, your root canals, fillings, cleanings, extractions, everything is fine during the first half of the third trimester. However, it is recommended from the American Dental Association that from the second half of the third trimester, which means closer towards delivery time, it's, you would try to avoid doing like a little stressful dental procedures like surgical extractions, things like that. Simply because one of the reasons is that, you are very pregnant and you would have to lay back for a long period of time in order for the dentist to have you in the proper position to do the treatment.
Yeah.
And it will be very uncomfortable and put the mother and the fetus under a little bit of stress to have them lay back for those sorts of procedures. So you don't want to do anything too close to the due date of the baby.
Yeah, makes sense, of course. And now let's talk about those recommendations that you have in terms of how we can ensure that we maintain our proper dental health, especially for pregnant and expecting mummies.
Okay, so again, this is from the American Dental Association, these guidelines that I'm giving. Most importantly, visit your dentist every 6 months, get your checkups done, get your cleanings done, deep cleanings if needed, if you have periodontal disease. Most importantly, you need to keep up with your oral hygiene. And this would mean brushing your teeth twice a day using a soft toothbrush. And yes, I've had a lot of patients saying that, when they use a soft toothbrush, they find that it's not cleaning their teeth properly. But one thing I like to say is that, okay, if you want to wash your car, right, you'd want to use a nice soft microfiber cloth or sponge. If you use something like a kitchen sponge or a steel brush to wash your car, it's going to wear away the paint, right? And when this is the same thing that's going on if you use a medium or hard toothbrush in your mouth, you're wearing away the protective layers of the teeth, and you're also causing damage to the gums. All right, so a soft toothbrush is recommended, brushing twice a day. And you need to use a fluoride toothpaste, right? So fluoride is the ingredient you want in your toothpaste that will help prevent against sensitivity, as well as strengthen the teeth and prevent against cavities as well. We want to avoid.
No, go ahead, doctor. Let's listen to those tips.
You want to avoid things like for daily use, like baking soda, charcoal, and herbal toothpaste.
Yeah.
All right, those can actually be quite abrasive, and herbal toothpaste tend to not contain fluoride, so there's no real benefits to them. In nighttime especially, you would want to floss, brush your teeth, and go straight to bed. If you have any nighttime munchies, snacks, anything, you would have to repeat: floss, brush, go to bed. I know it's difficult, but
I was just about to say, doctor, easier said than done, huh? Because when you're tired, you just want to hit the bed. You don't want to floss.
Yes. Yes, I understand.
Yeah.
In addition to that, what I would recommend, especially for pregnant persons where they have morning sickness and sensitivity, dental erosion, is that you would want to, if you go to your dentist, request a fluoride treatment. So it's a very high concentration of fluoride. You paste it on your teeth, and it helps prevent against sensitivity, wearing away of the teeth and cavities. If you do suffer from sensitivity, you can use sensitivity toothpaste, and that should help a lot in terms of relieving some of the symptoms.
Yeah. Now,
In
I'm going to go
addition
a bit
to
off
just
topic, Doc, but I think it also relates to the teeth as well. You get the argument in terms of, can women drink coffee, for example, or can they drink alcohol when they're pregnant? And of course, we know, especially with these sweet wines, it can cause the cavity. Of course, there's the staining of the teeth with coffee as well. And so do you advise women drink one or the other when they're pregnant? Is there a difference depending on the trimester that they're in?
no, well, in terms of the diet, well, alcohol is not recommended during pregnancy because you can have something called fetal alcohol syndrome. And in terms of coffee, the literature varies with the coffee and the caffeine. Some doctors would say to not have any caffeine at all. Some would say a little bit is okay. However, in terms of the dental aspect in it, in terms of staining, if you keep up with your regular dental cleanings, that should not be a problem.
And in terms of the, so we are doing these procedures, but remember, as pregnant women as well, they're taking supplements, they're taking pills to ensure that they and the fetus are healthy. Will these procedures, affect the medication or even the supplements that they're taking at this time?
No, it will not affect any of the any supplements, any prenatal supplements, natal supplements. The procedures we do will not affect any of those uh, intake or
Yeah.
any effects of those medications, and it will not lower the efficacy of those medications either.
Yeah, I know there's also some literature, Doc, on the fluoride. So I was surprised to hear you say that maybe women can use the fluoride as well.
Yes, yes, fluoride is, and there's a huge debate. I get it from
There
patients all the time.
is,
I get another
yes.
misconception about fluoride. Yes, fluoride is not harmful at all to you. It's actually very, very beneficial for your teeth. Fluoride is the only substance in the toothpaste in oral health products that is proven to help strengthen the teeth, prevent against cavities and wearing away of the teeth. These misconceptions people have in the public about fluoride being harmful is actually very untrue, and it's not evidence-based. The only way fluoride can be harmful for you is if you probably eat a whole tube of toothpaste, so if you're swallowing mouthwash or something like that. But there's no way that that is harmful for
Yeah.
daily use, right? Because fluoride is very, very beneficial. And I would see it a lot in patients where they say, doc, I've seen fluoride is very harmful, and I've seen this doctor said that, or I read this on the internet. But then that's why I'm here to educate the patients and the public to clear up those misconceptions. So yes,
Yeah.
fluoride is very, very safe. Unless you actually ingesting it, it will not harm you.
Ingesting it in large quantities. Understood. And after mummies
You
deliver
need to.
the baby, did I lose you again, Doc? Oh no. Can you hear me? Dr. Mahabir, are you hearing me? Oh,
I can't hear anything.
You can't hear anything. All right. Well, unfortunately, we're going to have to end now. But I feel like we're going to have you back on the show again. But let me thank you so much for joining us. And that was Dr. Adilah Mahabir, a dentist attached to the Tobago Regional Health Authority, just sharing some tips for pregnant and expecting mummies as they maintain and care for their dental health and their dental routine. On the Now Morning Show, we're going to take a break and be right back. Stay with us.